high atop the pastoral center of the Diocese of Camden, you're listening to Talking Catholic.
Hello, everybody, and welcome one more time to Talking Catholic, the diocesan podcast of the Diocese of Camden. And with you today, Marianela Nunez, myself, with our beloved Walsh. How are you, Mike?
Beloved. I can honestly say no one has used that reference to introduce me to anything. But thank you. That's very kind of you to say, Marianela. It's very nice. It's a good way. That's a very spring and optimistic way of introducing somebody. And we're in that time period of Easter and joy right now. So I like that introduction. That's good. That's nice.
I think you're beloved in the diocese, Mike.
There may be one or two people that would disagree with you, but I hope I make an attempt to do that.
That's great. How are you doing these days? It's springtime.
Yeah, it's going well. It's the Easter season. So what I'm finding is that everything I pushed off during Lent, because we were so busy during Lent, has now come home to roost during Easter. So Holy Week or Easter week, and now the rest of the Easter season is me trying to get done as many things as humanly possible. So it's been good. How about yourself? How are you handling Easter?
That's a good sort of like time of the year. I'm just enjoying the joy of the gospel at the same time that I'm enjoying the nature. Like you gotta see God in everything you do and in everything you see because He's in here. So I'm so much enjoying this weather and going outside with the kids, and it's a beautiful.
Yeah, it's funny you say that. Last night, my son Jack was at his tutoring, and Jennifer had taken him there. It was like 6 o'clock at night, 7 o'clock at night. And it was still light out. I was like, I'm going to go out for a bike ride. It was just so nice to go out for a bike ride on a whim at 7 o'clock at night at decent weather. It was just like, I'm feeling that sense of joy coming back. That's
definitely
good.
So like Easter and spring go really well together. I think God doesn't make mistakes.
No, you're absolutely right. That was when those two things came together 2,000 years ago. That was a fantastic moment because and in the history of the church, the fathers of the church are very wise to make Easter and spring synonymous, because it's true. It's a great opportunity to kind of revel in both the spiritual rebirth that occurs during Easter as well as, nature's rebirth. So I hope everyone's having a great Easter and a great spring, and I'm looking forward to warmer weathers. Now, Marianela, we have actually an episode this week that we've been wanting to do for quite some time, and it became heightened during COVID times, where we really wanted to talk to some of our school nurses. Now, I'm going to let our folks know that, we're doing this as a Zoom call, and our school nurses are working on the job right now. So some of our nurses are going to be popping in and out from time to time, and because they have students to address, and then they're going to come back to their computers. So you may hear Marianela and I do a little tap dancing along the way. But while we have everyone ready, why don't we introduce everybody? Marianela, if you could sort of introduce everybody.
Sure. So we have with us our high school nurse from Paul VI High School, Cele Walter. I hope I said your name right, Cele. Welcome.
You did. Thank you for having me. That's great.
Great. And we also have Shayna Benson from Saint Margaret Regional School. Welcome to our show.
Hi, thanks so much for having me too.
It is a pleasure. And not two, but three nurses. This is incredible, Mike. We also have Beth Abate from Assumption, and I think I messed up her last name a little bit. Say that, Mike.
Mary Beth Abate I actually went to school with an Abate, so that was always good for me. Mary Beth, are you able to hear us?
I keep going in and out. I'm sorry.
No, it's okay.
Can you hear me?
We can hear you. Yeah, we actually can hear you. I think we're catching you on your cell phone.
I'm trying to do both because they both keep coming out on me. So sorry.
Well, they're showing up, and we hear you just fine. So thanks for making the extra effort. We appreciate that.
Welcome to the show. We're happy to have you with us.
Thank you.
So, Marianela, why don't we start with Shayna? Shayna, let's talk a little bit about you. How long have you been a school nurse?
Not very long. This is my third school year here.
And what can you tell us a little bit about the school?
Okay, so I work at Saint Margaret's in Woodbury Heights. We offer preschool up until 8th grade. So we have little 3-year-olds walking around up to 14-year-olds. So, yeah.
How has it been this year for you? Like, you were a nurse for 2 normal years, and now this year COVID came, and how has it been this year?
It's been crazy this year. So I started St. Margaret's. This is my 3rd year here, but I'm also a new nurse too. This was my first time being a school nurse. I kind of slipped in here. Yeah, it's a little crazy. It's weird. Every year for me has been getting better, but it's been it's just been crazy. I have to say that the students and staff here are very resilient, and I'm amazed by just how well everyone has been really rolling with COVID-19, honestly.
Well, that's good to hear. And that's something actually we've noticed even from our vantage point outside of the schools, is that the Catholic schools in South Jersey have done an unbelievable job in being able to stay open. We should probably mention that too, if people don't realize this, but schools in the Diocese of Camden have been open 5 days a week for learning since September. And it's been a unbelievable, I almost call it an experiment, but in some ways it was an experiment to see whether or not we're able to do it. And unlike a lot of public schools, we were able to do it. And all the credit goes to the staff and the administration and the faculty and the parents and the kids who have been following the rules. And it's been amazing. They've been able to be in school all day. And as a parent of a 7th grader, I can tell you that I was thrilled, because I was not thrilled during remote learning last spring, and I've been thrilled all year. So congratulations to all of you. Cele, from a high school perspective, how long have you been at Paul VI?
Oh gosh, this is my 15th year here, and I had 20 years at Children's Hospital of Philadelphia. So it definitely has been a challenging year, but I will tell you, I'm thrilled that we've been able to stay open as long as we have. We have a school of almost 1,000 kids. I would say approximately anywhere like a little over 100 opted to be remote for a large part of the year. A lot have come back, and we have not had to close because of the number of cases. There's been no spread inside the building, which I think is a testament to any school. If you follow the rules, you can stay open. Yeah. It's the school is safer than many other places, and the partnership between administration, the students, faculty, parents has been absolutely astounding. And I think that has really allowed this in-person learning to continue. I'm sure my other school nurses have seen an increase in the amount of kids with anxiety, and those that have anxiety has gotten even a little bit more profound during this period of a pandemic. We certainly know, and we have friends that are nurses in the public schools and the schools that are not open all the time. And the effect that's had on the student body has certainly been very profound. So I'm thrilled that we were able to do what we've done so far.
That's, it's truly great to hear. And that has been a hallmark of this, is that there has been no spread in their schools. Infections have occurred. infections have happened and things like that. But the process that the Catholic schools use is that they will, yes. Because we use contact tracing, we know exactly who might have come in contact with someone, and that cohort of people could then go to remote learning for 2 weeks until we were certain that everybody was healthy, and then they were able to come back again. But even that hasn't happened with any great regularity, only in cases of where it was necessary, right, Marianela?
That's right. One of the things we really wanted to do this podcast is that this year, every year nurses are so important in our schools, but this year more than ever, I feel like you guys have taken a leadership role in our schools in many ways. And there's so many other responsibilities that have been added to your plates this year that, we really wanted to know what that was like and what you are experiencing. And I know, a lot of you have been working very closely with our health departments and the CDC guidelines to make sure you're following the protocols very well, along with the diocesan guidelines that we provide. So how has it been navigating all those offices and all of those areas that were sort of like not things you had to do last year?
We always have to work with the health department every year. This year, at least for us, it's been more than ever. And it's been kind of nice, like knowing that, okay, we have help outside and people that deal with, outbreaks every day. Again, though, luckily we haven't had, knock on wood, had any outbreaks, within the school setting. And again, that's just due to following the regulations, working with the health department, every week, if not every other day. But it's been challenging, but again, good.
That's great.
Yeah.
So, Cele,
yes.
I was going to say, how about from your perspective?
Yeah, I'll agree with Shayna. Like, definitely, we've definitely talked to the health department a lot more often. But again, I use that word partnership a lot, but that communication has been essential. And it really gives, I think, us school nurses an idea of what's going on in the health department in other areas, right? And they certainly see what goes on in the school setting. The same with administration. I've never worked as closely with my principal as I have this year. And right? And it's certainly given me a much broader understanding of her role and her job and how challenging that is and how you're trying to mitigate really everything. But the ultimate goal is that the kids are in the building. So anything you can do to make that happen. I've appreciated as a school nurse being included in a lot of the decision making that has occurred. And then again, like that partnership with the parents has been huge. Certainly, I know we've made a lot of phone calls, right? The other school nurses to kids when we're quarantining. And as difficult as that is, because you hate to tell a parent or a kid that they can't come to school. Again, it's another opportunity to increase information that is being made available out there. So I think in the long run, long run, the communication that has occurred this year, I hope that continues. And I think that's been a very positive thing.
That's great. What about you, Mary Beth?
I'm sorry, I didn't hear. I think I just got back on. Hello, can you hear me?
Yeah. I think we may have to hold off on Mary Beth a little bit because her connection keeps going in and out. But we'll keep an eye on. Yeah, no, that's okay. We'll keep an eye on Mary Beth to see if her connection stabilizes at some point. But just to get back to what Cele was saying is that that interaction between multi-levels of administration. Okay, so the school nurses were always the health experts in the building as a general rule. But now I have to imagine it was kind of nice to be sort of elevated to, sort of this resident expert role at the upper echelons of the administration. So Shayna, you're kind of a new nurse. Did you feel like you kind of got a baptism by fire, or did you feel like you were pretty prepared for what you were going to be faced with this year?
Well, every year for me, since I'm new, has been a baptism through fire. But it's also been good because I'm getting experience, and I notice that it's just making me into a better nurse. I think that there's no way I could do this on my own. I have all the staff supporting me, the parents too, the health department, other school nurses. We have, I call them if I ever have any questions, and just pulling in everyone's experience has been helping me this year. It's been, like I said, been crazy, but there have been some good things. There definitely has been more anxiety with everybody, but definitely the kids. I've been actually working very close to the guidance counselor this year, more than previous years. And I think that it just has to relate to COVID. And wearing the mask, which the kids have been doing phenomenal, like I mentioned before, but it's hard. It takes a toll.
That's something we've commented on a couple of times during other podcasts we've had related to Catholic schools during COVID, and it's the incredible nature of the kids to be able to be. I remember during the planning process for this, as I was talking to the superintendent of schools as we were going over how we were going to reopen. We were very worried about the young kids and whether or not they'd be willing to wear their masks all the time, thinking they'd be fidgeting with them and stuff like that. And what's been reported to me is that the young kids were actually the best. Yeah. They gravitated to it the fastest. Mm-hmm. It was the middle school kids that seemed to have a problem with it, but the little kids at pre-K through kindergarten, second grade, third grade, they seem to be doing without even a second thought. Have you found that to be the case, Shayna?
Yeah. And you know what? Because with remote learning, especially last year, it was so new to everyone. I really think that the kids appreciate being in school now. I think being forced to be on remote learning, and now they have the privilege to be in school during this pandemic. And we've been able to remain open through these mandates, through the mask, through social distancing, through working with the health department. The kids, I think they want to be here more than anybody, honestly. Yeah.
How about you, Cele, from the high school area? How have the kids been with wearing their masks and not having to?
They're great. I mean, yeah, their kids will try to get away with a few little things, but ultimately, I'll piggyback on
high school kids, right?
But I mean, I'll piggyback on what Shayna said, that absolutely they want to be here. So those reminders to kind of keep your mask on is good. And they see that it works. I mean, we're following the science, and the science works. I do want to say another thing about like that mental health piece. I've been really privileged here at Pulse X that my office is right in the guidance complex. There's actually a wall up this year because we were trying to keep the sick kids away from everybody else. But we have a great working relationship with our guidance counselors. We have a mental health counselor this year, and she started last year, and she's been tremendous. We worked together a lot when we were remote, putting out videos for students and recognizing that big mental health component is there. So we've been able to educate parents and teachers and students and kind of working through this together. As you said, Shayna, you're working more with the guidance counselors, and that's a great model. I mean, it's that communication has gotten better, and I hope once this is all over that continues.
That's fantastic. How do you feel like, parents are responding? It is hard to, send the kids home to quarantine, especially, when they have a healthy kid at home, but they know that it's part of the protocol. How has that been? Have you been getting so many phone calls from parents about, explaining those protocols?
I will say yes, but again, we're looking at that as an opportunity for learning. So we're certainly putting out weekly emails from the health office that we didn't do before. We have a COVID-19 page that updates all of that information. And again, I think as school nurses, a big part of what we do is educating, right? We're working in a school, our job is to keep kids in the building. So helping parents understand that and sort of navigate through that has been a good part of it. But yeah, it's very time consuming. I think there's a lot of ways to explain things to a parent so they don't feel as upset, because I think there's that sense that, oh my gosh, my child is being punished because they were exposed to COVID. And when you explain it that, okay, this is what we have to do, but also because you are following that, they're part of the solution and they're part of that team that allows the school to stay open.
Yeah. I also want to make mention, I think we lost Mary Beth, so we may not be able to get her back on the podcast, but just want to let everyone know, and certainly our apologies, and we'll try to get her back on a future podcast sometime later if she's not able to come back in. So we've been talking about a lot of your jobs during COVID times, which have certainly been important. But I also want to talk to you a little bit about, what brought you to this, and starting with you, Cele. I mean, you've been doing the job for 15 years and you came from CHOP before that. Yeah. I'm curious if what kind of drew you to this?
It's a great question. When I worked at CHOP, I worked primarily with, I guess all kids, but the floors I were on were more adolescent and school age. And then my later years there, I did a lot of perioperative teaching in the PACU and the perioperative complex. And I loved that aspect of the job, that sort of keeping you healthy when you leave the hospital. So I had always had this in the back of my head, and I was very lucky enough to have a position open here. That was a good time for me when my kids were still school age and able to kind of go through school as well. So that's part of it. Loving this age group and really seeing the piece of the job that's a lot of education, which I absolutely love. I will say I was very surprised about the amount of anxiety that I saw, and I'm sure you guys, other school nurses, see the same thing, not recognizing that was really part of the healthy population. And also I happen to love that piece of the job too. So not to answer the question, but yeah, I'm drawn to this age group and drawn to the good things about the job that I do.
That's wonderful.
Shayna? That's so great. Such a good story.
How about you, Shayna? What brought you in so recently?
Okay, well, I mean, the timing really was about timing for me. I did love like working with pediatrics in nursing school, but I wasn't sure exactly what I wanted to do. I just knew that I wanted to get as much experience as I could. I too was lucky that this position opened up. The school nurse that was here before me worked here for 27 years, and I kind of just slid right in when she was getting ready to retire. But I'm so glad that it happened that way. And I have to say, when I did start this job, she helped me out a lot to get me oriented, to know what exactly was required of a school nurse. And they do not teach you that in nursing school, that school nurses do so much more than, give an ice pack or put a Band-Aid on a knee. I was really surprised to see that, but it's been great.
I was talking to one of my colleagues today that I believe the only time I remember going to the nurse as a kid, I can't say that I ever went to the nurse to get out of anything. I was too afraid of the nurses, to be honest with you. But you get that upset stomach when you're at school, you go to the nurse. And the only other time I remember going to the nurse personally was for my scoliosis test. I'd have to get my scoliosis. And so I was saying that to one of my young colleagues, and she goes, "What's a scoliosis test?" And I said, "Do you go to public school?" She goes, "Yeah." I go, "I have no idea what they do in public schools, but I remember I got my scoliosis test in Catholic school." So let's talk about a little bit what your day is like, outside of COVID. I mean, certainly things have been a little different now, but Cele, when you like last year, the year before, what was a typical day like for a school, or is there such a thing?
That's a great question. I mean, I also kind of realized too, working here, how much you become that resource to not only the students, but the faculty and staff. So that's a big part of what we do. And certainly the population of student has changed. So there are a lot more kids that are in school that have more complicated medical histories than perhaps when we were in school. So I have anywhere from at yearly 7 to 8 or more kids with type 1 diabetes, a lot of kids with Crohn's disease, kids with tubes, kids with colostomies, kids with all sorts of more medically complicated things, but things that we can manage in the school building, again, that allows these kids to stay in school. So certainly my experience at CHOP was very helpful in sort of navigating that medical piece. So, I mean, the day can go from anywhere from, somebody fainting to, a crisis where a student is suicidal, or to, again, definitely to a Band-Aid, or to managing concussions, kids coming back to school from surgery, and sort of being that in-between person between the student and the student's teachers and the guidance counselor, explaining sort of what's going on with the student, again, to support their learning. So it really is very varied, but it's great. It's super interesting. I'll tell you, the day goes, I can't believe when it's 2:30 or 3 that I'm like, how did that day even go by? Because it's so busy. I have a student. Hang on one second.
Sure thing. Shayna, how about you from the elementary school perspective?
I definitely agree with what she's saying. Every year, the few years I've been here, there have been more complicated cases that come in, but we're able to manage it. And that's with the, help from the staff, the child's doctors, the parents, all that. On top, going on a little bit, besides the basic first aid and dealing with crises and, chronic medical problems, we also do a lot of the screenings, making sure that gets done before the end of the year is really important. And that has been a little bit of a challenge with remote learning. Some kids, when they're remote for so long, it's like, okay, when am I going to get their screening done? Are we going to be able to do that this year? Or are we going to just have to put that off? That's been difficult.
I'm curious with all the different things that you'll have to face in any given year. This is for both of you, but I think I'd like to ask Cele first. Do you have to keep up with continuing education? Is there some sort of continuing competency
Absolutely.
you have to go through? Oh, really? Wow.
Yeah, absolutely. Yeah. So initially, again, I was a certified pediatric nurse, a bachelor's in nursing. I also got my school nurse certification through Rowan, which is really important to do so that you understand kind of the requirements of the school nurse job, et cetera. Excuse me.
That's okay. See, I hope everyone's understanding it. This podcast was going to be one of the more unique podcasts we were going to do because we knew the nurses were going to be on the job when we did this. So we told them, listen, you got to leave. We totally get that. So Shayna, I'll switch it back to you, Shayna. Oh, wait, hold on. Cele, she just came back again.
It was just a Band-Aid, right?
What was the question?
The continuing education.
Yeah. And certainly as nurses, we have to keep up in order to keep our nursing licenses. We have to do a good amount of continuing education. There are amazing resources out there. I mean, being a school nurse, there's the National Association of School Nurses, which is excellent. I'll be right with you. And it is, again, a great resource for information. So yeah, we definitely do continuing education because you are right there. You've got to be current. You got to know what you're talking about. Excuse me.
So Shayna, how about your perspective? I mean, you're kind of right out of school for this, but have you found that the continuing education, on your perspective, has been helpful?
Oh, definitely. I don't think I could do my job without staying up to date, it'd be scary if I tried to do that. So I never would. I kind of feel like I'm going to be in school forever at this point. There's a lot left to learn. There's so much out there. And especially with COVID, everything seems like it's changing every single day. So I'm constantly trying to stay ahead of the curve on that. I mean, yeah, because that'd be the worst thing. I tell somebody they have to quarantine for 2 weeks and oh no, it's actually, we're not quarantining ever again.
What would be one of the craziest things that have happened to you this year to handle as a nurse, and how did you handle it? And what was, did it have a good outcome?
In relation to COVID or just
just in general, as a school nurse, what's been your one of those moments that you would always remember as a nurse?
So I did have to administer an EpiPen to somebody who had no history of allergies. So that was crazy to me, especially before I had asked the nurse that was here before me, I'm like, in your 27 years, do you really ever have to administer any of these EpiPens? 'Cause I have a lot here with students that have allergies, and we have our school stock supply in case of emergency. I said, no, I never have. And then the first year I was here, it had to happen. What? But so that was crazy to me. But at the same time, when you follow the protocol, you stay up to date on your education. You know what to do. I look back later at the situation. I'm like, how did I stay calm during that? But during it, I mean, it's just second nature.
I have to imagine that's sort of the nature of being a nurse, is that I recently had to go to the doctors myself for an issue that I was not particularly comfortable with. And this is actually something I remember when my wife was giving birth 12 years ago to our son, almost 13 years ago to our son. She was very nervous about it. And I remember saying to my wife, just keep an eye on the nurses. If the nurses look almost bored, even though you think it's terrible, you're fine. If the nurses start looking concerned, then you may want to be concerned. But I've never in my nearly 50 years on this earth, I've never come across a single nurse that's never looked anyway, like they were in any way, shape, or form perplexed by what was about to happen. And it brings me great comfort, to be truthful with you.
Yeah, that's a good measurement. point, Mike.
Yeah.
I'll take that in consideration.
So, Cele, the question Marianela had asked Shayna when you had stepped away was any particular peculiar things that you've had to deal with in the last couple of years that you kind of came out of left field that you never knew you'd have to deal with?
Oh gosh.
That many of them, huh?
Yeah.
Well, you know what? Nothing that really stands out. I mean, certainly I overheard you talk about the EpiPen. We've definitely had emergencies like that. I've had to send kids to the hospital. I had one of our cafeteria workers that I was called to look at her. I'm like, oh, she's definitely having a heart attack. And we got an ambulance for her. So I will say probably the more unusual thing is because I'm coming from a pediatric background is to sort of re-educate myself about a lot of adult stuff because we do have, a staff of over 90 staff and adults in the building. So you kind of got to know that stuff as well. But I love what you're saying about being calm because that's the key. You got to fake it to make it. Just like if you look calm, that person's calm. I had one of our teachers had fallen off the stage and first thing in the morning, dislocated his shoulder and he was in shock. I mean, it was so painful. But you have to kind of go, hey, you know what? This is going to be good. Can you call an ambulance? Okay, we're good. We got this. So I think it's just that thinking on your feet and being calm. But also, that's a good thing you're teaching the faculty too, right? We do teaching at the beginning of the school year and help teachers to sort of navigate that. If you have a student in your class with epilepsy, don't panic. Number one, be calm. And if they get that message from you and you give that message to them, as you said, you saw that, gave that message to your wife, you're seeing me being calm, things are good. And it does make a difference. So I don't have one thing in particular, just lots of little things.
Well, that's what's so unique, for both of you. You both have fairly large student bodies that you're dealing with. I mean, Cele, you're almost 1,000, right. And you figure that's there's a possibility that's 1,000 different patients you might have to deal with, not including the 90 staff members, which I hadn't even considered until you said that. I'm always thinking parish nurses are there for school nurses, rather they're there for the kids. I forgot. Yeah, sure. Something might happen to one of the staff members or faculty or somebody like that and having to treat them. That is a lot of understanding and information to keep in your head. Now, see, I know you've been a nurse for a long time, but does it ever feel, I mean, you're well seasoned. I didn't want to suggest anything otherwise.
You could say that. Oh, listen, I never thought I'd know as much about messenger RNA. I thought that was something I learned in college. Now I've got to really not only understand that, but explain it. So it is constant learning, which I love. So that's a plus. And as you said, we reach out to other school nurses. There's a lot of amazing resources out there. And, the more you communicate with other people, the more you learn, the more they realize what you do and vice versa, but yeah, you just have to kind of be prepared for anything, but there are good resources out there too. So it's not like we're, figuring out as we go along.
You brought up an interesting topic of the mRNA. So have you been doing a lot of vaccination training? People coming to you and asking, should I get the vaccination? Which vaccination should I get?
Yeah, there's a lot of questions and you have to be really careful not to be biased with what you think someone should do. To give the facts. So I am constantly reading, but again, I bore my family. I'm like, well, listen, do you really understand how this, they're like, I don't care, Mom. I don't care. I love it. I geek out with all the other geeks. And I think, as awful as this COVID is, it's really been able to advance science in the sense that at least these messenger RNA vaccines, which were sort of something, it's not new. It's been around for about 20 years, that idea. They've been able to really go with it and make something that is amazing. So we're really witnessing some huge leaps in medicine and science. Unfortunately, of course, in the negativity of a pandemic. But yeah, I think my geekiness about wanting to understand it, I feel like I can explain it fairly well, or at least point people to the right information. Because you guys know, there's so much misinformation out there.
There is
so much on social media, and parents will reiterate what they've read or heard somewhere else. And, it's a great opportunity to just give good information that people can make their own decisions based on what's real.
That's good. You mentioned something about, to see a lot of anxiety within the student body this year more than others. And, one of the things that we are, sort of like very happy to have in our schools is that, we have our faith and we have God. How do you feel this has helped you as a nurse to deal with, those situations, as we not only include, but God is basically the center of our schools, and that includes our nurses' offices too.
Yeah, that's something. It's beautiful. It's something that is not just like a go-to, but it's a shared faith. And even if we've got a number of kids here that are not of the Catholic faith, but that shared understanding of what it's like to be in a school where this is being taught, where these are the ideals that we hold true. Having that faith is I don't know, it's huge.
Yeah.
It's huge. Being able to, Father Nabrita is still able to celebrate daily mass in the morning. There are a number of kids that I see now coming in the morning because we're doing early temperature taking that will go to mass in the morning, and being able to sort of have that shared faith and to be able to talk of that in the context of what we're experiencing is, it's wonderful.
What about you?
Yeah.
It's great.
That's one of the things, and maybe Shayna, you can talk about this a little bit. This is, the nice, we always talk about the nice thing about being in a Catholic institution is, the freedom that it brings us to bring other elements into our day-to-day life. When we talk to teachers, they'll mention how, they can talk about, if they're giving a math lesson, if they're giving a history lesson, they can talk about God and that, and the freedom that entails. I have to imagine in the nursing field, that it must also be nice to know that, if a student wants to pray while they're in their office, you can pray with them in the sense of calming them down or lifting their spirits. Shayna, have you found, sort of that spiritual interaction is something that's been beneficial to you in your work?
I definitely think, like Cele was saying, that being in a Catholic school, and even if not all the students, are part of the Catholic faith, they do have that shared understanding, and that's something that everyone here can relate to. And during times of distress, which a lot of times when you're in the nurse's office, you're distressed, it can bring you comfort, and that's something that we could definitely rely on.
Yeah. I'm looking over. Cele, are we looking at you in your office right now?
Yes.
It's just nice to see. I'm looking at you in the nurse's office, and there's a crucifix over your shoulder.
Right.
It's over top of a cow and a field of sunflowers.
It's still there.
But it is hanging up there.
Yeah.
Your office looks very welcoming. You've done a good job keeping it.
You want it to be nice and calm. And I can also say, like, not just this year, we've had I'll give you an example. We had a student whose father was dying, and her girlfriends were very close with her. And then on the day he passed away, she was not at school, but they all came to my office very upset. Mm-hmm. And how wonderful was it to be able to say, hang on a second, let's get the chaplain, let's go pray. And we went to the chapel. I mean, I could choke up on this. And the priest led us in a few prayers, and we were able to speak out loud about what this man meant to these girls. I can't think of anything more beautiful than being able to do that and facilitate that happening in school. Not just one of many, but it was a great experience.
That's. I mean, I got chills you saying that, because that's a very powerful. I had something similar in my life happen. I was a teacher at a Catholic high school, and we had a student die, and I was unprepared. I was younger than Shayna, and I had no idea how to handle it. His class was my first period that day, and the art teacher, as it turns out, I shared some space with, and he came to me and said, "Why don't you read the footprints prayer to them?" And I've thanked him every time I see him ever since then, because that made I had literally no idea what to do. And he said that, and that opened the door to everything in that class. We had it's very similar. We had conversation, and we prayed a little bit, and it was amazing. But had I not been in a Catholic school, that never would have happened, and I never would have had that ability. It's a great opportunity.
And Michael, don't you feel that it improves your own faith? I mean, it definitely strengthens your faith when you're able to have the privilege of seeing it through the eyes of kids every day.
Yes. It's absolutely true. It's the thing that, so when I went to school, I went to school thinking that I would be a teacher. And then I was going to be a history teacher. And what I found was that history teachers don't retire, they die. They never leave their job. So it's very hard to find history teacher jobs. So I became a reporter, and then I became a PR guy. That's how I got here. But teaching is still the thing I love the most. And so anytime I get an opportunity to come back into the schools, just being around the kids, I do a spelling bee every year with my son's school. And I just love it. I love every second of it. So I'm very jealous of the two of you that you get to spend so much time. And I certainly know that, we're talking very positively. I'm positive that there are headaches in your lives as school nurses as well. But the fact that you both seem to have such joy for the job is really reassuring to me. But there was something you mentioned, the both of you have mentioned sort of a little bit, and I kind of want to get back to this. And that was sort of the psychological stuff. When we were in school many, many years ago, I was anyway. There didn't seem to be as much of a focus on psychology in terms of, students' mental makeup and things like that, or emotional well-being. Is that something you really are finding that you're dealing with, like in terms of anxiety, a lot more than you would have expected 2 years ago?
I mean, I can speak to that. Absolutely. And again, coming from a hospital background where the general population you're seeing isn't the typical population. You have kids that are acutely ill and are dealing with things on a psychological level for a lot of reasons because of what they're facing physically. In the school, it was astounding. And we're looking at like 28% of students have a diagnosable mental health concern. That's huge. Yeah. And the model in New Jersey is for the school nurses to work in accord with the guidance counselors. And that's so very important. And it's really important to educate faculty and staff to that as well. And being that resource, I mean, we're resources constantly to get kids referred out into the community. And again, it was mind blowing, but also I see every kid I can see where I'll probably have this conversation, especially in normal times, several times a week with a parent and a student that, okay, this is what's happening. There's great help out there. Here's what you do. If they're on medications, this is how they work. And I've yet to see a student not get better. And I think for a lot of kids, knowing that they're not alone, that they're not the only ones who are feeling this way, is really helpful too. I mean, their kids are starting clubs at school, a Mind Over Matter club, for really just addressing mental health. So, it's so important to them. And it would surprise me, honestly. I did not expect to see that coming into a high school, but I'm also really hopeful because there are so many good resources out there that, and I think the school nurses are a big part in at least getting those resources and those families hooked up in a way that can be most beneficial to them.
That's great. Shayna, have you found that to be the case? I've heard that mental health is something that seems to be creeping younger and younger. Have you found that at the elementary school too, that you're on the lookout for that?
It's really, it's hard. I do see there's definitely been an increase in anxiety and other, mental health aspects this year, especially. But when you get to kids who are young, they don't always understand what's happening. They think that, oh, my belly hurts, I must be sick. But a lot of times it is from stress, anxiety, something else is going on. It's hard sometimes to pinpoint it. So I find that I'm constantly on the lookout. If I see somebody down in my office more often than usual, I do my normal assessment. Everything seems fine physically. I might, I'll call the parent and I'll give the guidance counselor a heads up, like, hey, you know what? Maybe there's something else going on that we need to look into, whether it's anxiety or something in the classroom or not. But that has been difficult. The younger you go down, honestly.
And I can imagine that during COVID times, that's probably something that's been heightened a little bit, that sense of anxiety with some kids. Like we were saying before, I've been amazed at how resilient kids have been in terms of, how they handled things. But even my own son, he's asked me questions in the past year that I wouldn't have anticipated a seventh grader asking about, related to vaccinations or death or illness or any of that kind of stuff. So have you felt more questions coming about that from either from the students themselves or their parents or the staff related to anxiety, of uncertainty, things like that?
Definitely. A lot of parents want to, know what help is out there. I think that it's been more prevalent than ever with everything going on. I do get questions from students as well, but I do have a younger population, so it's not as often as I'm sure with Cele. But yeah.
How do you feel like, talking about mental health, I think there's being a challenge for the school teachers this year, to be teaching remotely and teaching in person at the same time. We know it's being hard for many, and they've done it. So how do you feel you've been there as a nurse to support the teachers and the staff in the school, and how have you sort of like improve the relationships you have with the teachers this year, given that opportunity?
I mean, definitely. I mean, it's just through communication and knowing that we're all here for each other, to help how we can. Our administration here has been absolutely fantastic, and I think very understanding to the needs of the teachers who have been through, I don't know, a lot this year and last year, and having to switch from remote learning to in-person learning, it's very difficult. But they've done a good job. And like Cele was saying earlier, that communication that we built this year, I do hope goes into next year and years after.
How about you, Cele? That's great.
Yeah. Well, I mean, there's a lot of teachers that are experiencing their own anxiety, that have had their own losses due to COVID, teachers who have lost loved ones, husbands, family members. So the stress that they're experiencing, the fear, certainly that we addressed at the beginning of the school year, where we're like, as you said earlier, Michael, like this is kind of an experiment. We don't know how this is going to go. Mm-hmm. And I think a lot of teachers felt that way. So there was a lot of anxiety about that. And again, this communication, making sure that everybody has the right information to help them do their job, understanding what it's like to be a teacher in the classroom. When you see, wow, what's it like to be in their shoes? They're teaching not only to a classroom, but also trying to teach remotely, also trying to navigate all of that, all of what's going on in their head. I think, again, it's made me understand a little bit more what it's like to be a teacher in the classroom, but also that, they're dealing with a lot of stress and anxiety as well. So talking about it, getting resources out there has been huge. And I hope it continues.
Cele, I'm curious, in your contacts from outside of the school, maybe former colleagues or people that professionally from either other public schools or actually even the nursing profession outstanding, maybe from when you were a CHOP. How are nurses holding up during these COVID times? They've been frontline workers throughout all of this. I'm curious.
I think the relationship we have with each other is huge. Talking to each other, understanding. There's been a lot of support from not only the local school nurse associations, the Camden County Association of School Nurses, Gloucester County, has been really helpful. So, I think we're just like everybody else. I will say this: being a nurse has the benefit of being kind of thanked for what you do all day. My mom, who's still living, was a nurse, and she said nursing is a selfish profession, which I didn't really understand until I became a nurse, but it's very true. How often are you being thanked for what you do? So there is that. Yes, it's stressful. Yes, it's hard, but people are saying, thank you so much. We're really grateful. And it's lovely. You feel embarrassed when people say that, but it's also very reaffirming.
Wow. I was at the doctor's today. I thanked my nurse 3 times. I didn't even strike me as anything peculiar about that. She was great.
People thank you all day. People don't. It's not part of.
Not a lot.
Exactly. So, it's like as soon as
thank you, Mike.
Yeah, I'm more in the complaint department than the.
And that's debilitating.
Well, now that you say that, recently my niece had surgery and was at Virtual Voorhees for a couple of days, and when she was ready to go, my sister was so thankful with her nurse that she wanted me to translate because she wanted to speak to her so deeply that she wanted to make sure that she understood exactly what she was saying. And, the nurse was crying at the end. Like, she just said the nicest words. Like, she was so thankful for her, for her care. Because, I think that when you see a good nurse, what distinguishes them is their care. Like, if you see that you actually care to have the patient comfortable and do whatever they can to make sure that happens, that it really makes a difference in people, and people sense that they experience it. And so I think nurses are great. So we are.
Yeah, but everybody is. We're just lucky enough to get thanked all day. So, and if you remember that, then, you pay it forward, right? You thank the teachers for what they're doing and recognizing what they're struggling with, and kids as well. So, it sounds like a big, like, oh, we're all, this moment, but, understanding that makes me love my job. And you can certainly bring that out there to other people. When you thank them, they're happier.
So, Cele, as we're wrapping up the podcast last 4 minutes or so, I am just curious, is there anything you'd like to see now that we've gone through this experience of COVID times, for both you and Shayna, anything you kind of hope to see carry forward that maybe has changed in the last year for the better?
Definitely. I mean, I've been brought into with administration in decision making, and being and having what is happening in the health office, making that heard to administration. And I hope that continues. I feel like that, again, that communication, that partnership is huge. And going forward, I can only see that as a benefit. So I hope that continues.
That's great. How about you, Shane? Any changes, any new things that you hope to see in the upcoming years of your future 30 years as a school nurse?
No, I definitely agree. Communication and partnerships we've built this year, with administration, our guidance counselors, and our teachers. I really hope that continues to stay and, just strengthens over the years. This year has really put that to the test. And I think it just shows, what we can do when we all work together as one unit and a team, and it's, get through a pandemic. So it's been great.
I'm wondering, do you have any advice for parents, of students who not necessarily just during this time, but in general, the things that they should know, that like when a student comes to the school nurse, or when you end up calling them, is there anything like that they should be aware of?
Like, what do you?
I love asking a question that nobody knows the answer to. No, I was just thinking that, I think so often people get nervous when the school nurse calls or something like that, or if, I was just curious, is there anything that the parents should be aware of when dealing with the school nurse?
I think, go ahead, Shayna.
No, I mean, I think just know that we're here for you and for your child, and we want what's best for your child. A lot of times I'm calling parents just to give, hey, a heads up, they're totally fine, but I just want to let you know, I saw them today and this is what's going on, keep an eye on it. And that's it. It's a lot of monitoring with school nursing. You don't always have to be afraid when you get that phone call. A lot of times we just, want to update you about your child.
I will say that is something I do appreciate. The few times that any of the school nurses have called for something happened to my son, they always start with the same sentence: Jack is fine. Just want to let you know. It makes me feel so good when you start out with that first sentence. I'm like, okay, tell me what happened. Okay.
I think parents understanding that our job as school nurses is to keep kids in the classroom and support their learning. So when we're calling them, it's to do that, whatever it might be, just to give them advice, give them information about what something happened at school. Certainly, we hate the phone calls when we say we have to quarantine your kids, but for the most part, I find parents are very grateful when, again, if you start the conversation with, you don't have to worry, but here's what happened.
That is the thing. That's the one thing that I've been very impressed by, and I have to give our parents a lot of credit in that case. We have had a number of occasions where a bunch of the schools have had small groups having to quarantine for 2 weeks just because of the nature of the pandemic. And we were kind of prepared for getting a lot of angry emails or phone calls about that. And actually, everybody's been really open-minded and chill about it. I'm not saying everybody's been thrilled about it, but it really has been a good and positive experience in terms of the support that the parents have been giving us. Mm-hmm. So as we wrap up the podcast here, I want to thank Shayna Benson and Cele Walter, and our deepest apologies to Mary Beth Abate, whose connection just wouldn't hold together. But thank you all for the great work you're doing in our schools, and we really appreciate it. Thank you very, very much for joining the podcast. Marianela, thank you very much for setting this all up. And to our listeners, thank you for listening, and we'll talk to you again next week. See you, everybody.